everyone for joining. We have a really awesome Fireside Chat today with Loren Academic Services. We've got Ocean Mao, who is going to be facilitating our discussion. Today's topic is it's a very important topic, changing the medical narrative, depathologizing trans and queer identities. So before we start on this, I want to just say that I'm going to be taking notes and really acting as a listener in this call. I'm not a trans person, and so I can never know what that experience is like, but I'm here to support and listen and, help contribute in the ways that I can. So that's kind of what I want to start off with, and I'm really appreciative for all of you guys being on today. This is like our 6th or 7th chat we've done with Loren Academic Services. We've really focused a lot on mental health, inclusivity, and how that pertains to medicine and higher education. So it's been a really great series so far, and I'm looking forward to continuing with tonight's discussion. So Ocean, I'll let you do an introduction, and then we'll have everyone do a little introduction of their own. Just say your name, what you do, a little bit about yourself, and what you're looking to get out of this chat today. So for me, I'm really just listening, taking it in, and I'll be taking notes at the bottom. So you all will have access to these notes at the end of the chat if you want to look back. And again, we are live streaming. So for any questions that we get, Connor will be pulling those from the live stream chat on YouTube and feeding them into the chat box for us to discuss as well. So Ocean, I'll let you take it away.
All right. Hi, everyone. My name is Ocean. I use she, her pronouns. I am from Canada, Chicago transplant. I am a therapist. I'm the executive coordinator at Loren Academic. And for me, I think sort of the whole issue of LGBTQIA rights across the board is very important to me. But I had initially proposed this chat, and I'd proposed that we do this chat first because I think that very often trans people get overlooked under the queer umbrella. It is more like everyone assumes like, yes, the gays, the lesbians, and I do fit into that category, but trans people are not as widely talked about, and there's not as much education and information, nearly not as much as there should be. And so for me, my goal is just starting a conversation, providing awareness, talking about what is out there, what's not out there, what people should know and choose to not acknowledge, what people maybe don't know and need to learn. So I'm going to go in circular order on my screen. So Loren, you're up next. Please give us your pronouns.
Hi, my pronouns are she and her, and I'm really glad to be here today. I'm executive director for LAS, for Loren Academic Services, and when Ocean proposed the chat, I wanted to make sure to sign up and be part of this. One of the main reasons is as somebody who's, how do I want to put it? As somebody who I think works in healthcare and provides support for students and residents, et cetera, in healthcare, one of the most important things I think we learn at LAS is to pause, to listen, and to be, incredibly just aware and open to what we're hearing. And so for me, this is an opportunity to participate, to listen, to learn. And I'm looking forward to it. I really genuinely am excited about this. So thank you for letting me be in here.
Unmute myself. And then Hayden, you are up next on my little view panel.
I'm Hayden D. Porter. I use they, them pronouns. I am a incoming 3L law student at DU. I am a trans person who has had a lot of experiences in the healthcare system, as just going as a patient. But I do a lot of work around LGBT rights. And yeah, I'm happy to be here.
Welcome. Thank you for coming. And then Charisse, you are up next.
Hi, everyone. I'm Charisse Maynard. I'm a healthcare strategist by trade, but I also work with LAS as their strategist and content creator. I'm very happy to be here to support this community and this effort, and I'm excited to hear all the insights.
And then last but not least, at least for now, we've got a couple people running late. Pamela, please introduce yourself.
Yes, hello. My name is Pamela Meadows, pronouns she, her. And so I was introduced, and I appreciate the invitation from Loren. Thank you so much. As this was brought to my attention radar, I was able to jump from one meeting to another impromptu meeting. It's like, okay, let me just slide right in. And yes, there's a space. Yes, okay, great. I work at the University of Illinois College of Medicine, and my title is Outreach and Recruitment Coordinator, as well as Program Student Advisor. I advise and counsel pre-med as well as current students with a targeted focus with our mission to recruit, retain, and graduate those underrepresented in the field of medicine. But as a long-term higher ed professional, I've supported, advised students for several decades, and as someone that identifies as being an ally, and in the context of everything that is happening. There's so many intersectional areas in regards to race, class, sexuality, sexual orientation, and these conversations are happening now at the table. And I want to be as aware, as informed as possible, and represent the LGBTQ community well, along with the other issues. So to do my part in the spaces I can navigate in, but at the same time to be an ally and listen. And I'll stop there. I'll stop there. So thank you for making me aware of this. Thank you for inviting me. Thank you for having me be a part of this space. And I'm looking forward to the experience.
Glad to have you. Really glad to have all of you here. I know we've got a couple who are running late, so we'll pop them in and do introductions as they show up. But one of the first things I just wanted to mention, I think many people on this call already understand the importance of it, but one thing that we started with is I asked and everyone shared their pronouns, and that is first and foremost a very small thing. It takes you about 2 extra seconds to ask for it, and that's a very small thing for you and a very big thing for people who feel uncomfortable with their pronouns that they were assigned or the pronouns that they present as. And so not automatically assuming what pronouns someone uses and just sort of going out there. Step number 1. And within that, also talking about what name would you like me to call you, because my real first name is a lot longer and I don't use it. So even though I'm not a trans person, asking me what name I would like to be called is nice. And that is often asked of people, like, oh, like Robert, do you want to be Bob, Bobby, Robbie? Just the same for anyone, but asking that in a classroom, in a work environment, anywhere outside of that when you're working in a group is really important. So everyone on this call, I put a whole bunch of questions to consider in the agenda. I probably threw out way more questions than are actually necessary for an hour, but I just wanted to start with what sort of things made you want to join a call like this, specifically a call about talking about trans people and the medical narrative, talking about the medical side, not necessarily the medical side of transitioning, but the medical side of how we treat trans people in medicine.
I was at a meeting about a year ago, a conference, and it led to a retreat that we did at LAS to really kind of change some of the information. I guess it was 2 years ago, so it changed the information that we were putting out, as well as information that we were asking to gather. And one of the physicians at the meeting talked about, she was from France, and just the experience in France of somebody who was at a point in life where they were transitioning and came into the emergency room and was asked to fill out paperwork. And as a result of filling out the paperwork, there was a perception that this individual was one person, was biologically speaking one way versus another way. And as a result of that, the care and the provision of care was completely inadequate. And there was a lack of sensitivity in terms of how that went, how that unrolled, how that sort of occurred. And we had a long conversation about it at the conference. It was part of a presentation and workshop. And my takeaway from that was that, to your point, Ocean, like just changing one question or radically changing a lot of things can make a very big difference. That doesn't have to go, that can make a big change, a big difference. So for me, coming into a meeting like this to sort of explore information that is out there, to learn more, to listen, to kind of reaffirm being an ally, and not to shy away from the conversations I think that are difficult to have for some people sometimes. So to say, yeah, let's dive in. So I had just a desire to be more aware and more supportive, and make sure we're doing what we can do at LAS to, be inclusive and to represent all students who are learning in medicine. So that's the reason.
And then for everyone on this call, feel free to sort of hop in. No one's talking, I might call on you, but if you have a thought that relates to something someone said or is totally different, but it popped in your mind and there's a lull in conversation, hit us up. We definitely want to make sure that everyone's thoughts are included. We don't want to stick to a train of thought if that's not what you feel you need to get out of it or what you feel is most necessary. So anyone else, thoughts about why this conversation, why you think it's important, why you're willing to have it, why you think other people should have it?
Before you call on me, so let me just jump in. So actually something that Loren said that registered with me was the sensitivity and to listen and also to address. So what prompted, or why is it important? Well, I think one, though I've worked in higher education, though I find that my role as an advisor, I consider that's a calling. So I definitely identified, no matter what the title is, that I am an advisor. And I value the privilege of students that share their vulnerability and their insecurities and their transparency with me as part of their journey. So I want to be more tuned in and expand that as much as possible. And also being aware of how it is, well, first being a person of color and being part of an underrepresented group, identifying in parallels of those experiences. And again, I want to be able to stay on point, but also I realize as we're doing things that some of this is the unpacking, it's messy and such. I think about, I actually have a student in mind right now, and there was an incident where two administrators were trying to it was perfectly logistical, and trying to find out the person's records, all the norm, but it was in an open forum with a cubicle, and the grad assistant that was working knew of this student beforehand, before transitioning, and just said out loud and volunteered and basically outed this individual. And when I heard about this, I had so many questions and concerns. And I share that just because this person was not only trans, but a person of color, and in the people of color community, especially now as I'm seeing, like, let's not overlook the other identities as part of the community. And so that's actually the summary. I did my follow through in that I articulated my concern. I articulated and made known how I thought processes were dropped. Like there was no communication in the sense of what was the follow-up. And also, I think for me, the gravity is just like the not knowing. We can't afford to not know. And I expressed to it higher up, like, if it was addressed, that's great. This is my advisee, and they are being killed for this. And so I don't know, even though maybe that person was well-intended, maybe not, I don't, and the not knowing and yet knowing what I do, it's that awkward role and everything. I don't think individuals that were involved knew the gravity. So that, as well as many other things, not knowing the gravity, not knowing to be able to really, again, expanding my sensitivity and understanding and awareness.
Thank you, Pamela. So we have a question from the live chat. Joy, thank you for tuning in. And our question is, how common is it for non-binary and transgender to be an option as a person's gender on a form? And talking about how it seems like it's only slowly being adopted. And A, yes, it is slowly being adopted, but B, this actually brings me to a point that I wanted to have a conversation about, which is there are on the CDC, on the AMA, on the AAMC, resources specifically geared at competencies for what to do in this scenario. There are competencies for frontline workers. So that means people at the front desk are supposed to be trained in talking to a person, making sure they know that person's pronouns, making sure that they are getting a whole picture of who the person is instead of assuming. There's language about what to say, what not to say. And these are like, I searched on just very briefly, I'd seen a couple, but within 5 minutes, I found like 300 pages worth of resources. So Joy, in answer to your question, not very common, but then also as a discussion point from all of you, did you know these resources were there? Were you aware of it? And then also your thoughts on the fact that these resources are there and it seems like they're really not being used in the way that they're supposed to be.
I'm going to jump in and just say I went back to just look, and actually the conference I was referring to was longer ago than I had perceived. And I remember when we looked through like forms and things like that at LAS at the time, one of our employees was transitioning, and that individual was actually one of my first employees. And I remember going through a period of a certain number of years while this individual was going through, substantial changes. And I'd like to believe that we're open to conversation, open to discussion, open to, to what a person is going through and what somebody wants to share. It's a work environment. Was interesting was that to me, it felt really seminal coming from a clinical background and making sure that people were feeling comfortable and understood. And so there was, I think in some ways, Pamela, this makes me think a little bit of the conversation you and I had earlier today about just what it means to go through a significant, cumulative set of events that are in somebody's life from day one. And at the time, Pamela and I were talking about sort of racial barriers and so forth, and to somehow not be able to acknowledge that. And so I think that, I guess, to the point you were making earlier, Pamela, I think that it's something that we have a responsibility in the healthcare profession. I think we have a responsibility as human beings. I think it's something that it would be irresponsible not to be open but it is also not the responsibility of an individual, I think, to just simply educate everyone else in the room. And I think that's the other part of the takeaway that I guess I'm thinking about. So in regard to, I don't know if that's.
Yeah, thanks, Loren.
Yeah.
Hayden, I had a question for you as a person, a law student, and someone who is going to be ultimately practicing law. I did realize that I assumed that, but I'm.
Yeah, no,
So again, I've heard that you're not supposed to ask lawyers for legal advice unless they are being paid. But
and if they're licensed.
yes, so you're not licensed, perfect. So from a legal standpoint, talking about it in terms of best practices and cultural competence and things that are like posted by an organization talking about like these are the guidelines that you have to follow. Within that, what are the, this is running. What would you say are like, how binding are those? How big of a deal is it if those best practices aren't followed?
It really just all comes down to, I think, accountability. So just unrelated to like medical forms best practices, just thinking in Denver there was an ordinance passed like 2 years ago that all single occupant bathrooms had to be labeled gender neutral as rather than having one male and one female bathroom. So like that is an ordinance that went into law, and now 2 years later I can count a handful of places I've been that have not complied. So just because we have these laws in place doesn't mean they're actually going to be followed. So that's a problem for in terms of making more inclusive practices. But just having, been to the doctor many times and been to many different doctors, the only time I've ever had a doctor have me list like my identity or like pronouns and gender was my plastic surgeon for top surgery, where you would hope that they would have that in their forms as a doctor performing trans care. But I mean, I do have like my license is an X, so I do have that third gender, but then there's no other systems haven't caught up to where we're at. So when I go to the doctor now, I'm never have the option. So what I usually do is just leave it blank and let them assume what they want. Because sometimes I just don't want to have to, if it's like not going to be an invasive doctor, like when I get my eyes checked, I don't want to have to talk to them about me being trans, specifically non-binary, on testosterone. And it just complicates things further. So there's definitely, not only in medicine, but in many, many fields, there's a huge lag in catching up.
Thank you. I would also like to welcome Liz Ellis. Hey, Liz. So you did miss a brief round of introductions, but everyone here is lovely. Hayden, they, them is a law student. Pamela, she, her, she's outreach and recruitment at U Chicago. Loren is my boss at Loren Academic, so we've also known each other for a super long time, same with Gertie, and Charisse helps me deal with everything front-facing. So if you've seen a picture of me recently, it was probably Charisse. So I would love if you could introduce yourself, tell us your pronouns, and a bit about why you wanted to join this call, aside from because I asked you.
Oh boy. And my phone's ringing. Hi, my name's Liz. I'm she, her. I'm currently a licensed clinical social worker working at Planned Parenthood of Illinois. I'm at our new health center in Waukegan. We are a big Illinois healthcare provider. We now have 18 health centers throughout the state. Upstate, downstate, and one of the services we provide is gender affirming hormone therapy for trans identified people. We also provide other reproductive healthcare services for people who are trans identified. So this felt like a pretty appropriate phone call to be on, or meeting to be on. We have a lot of internal, the social work team is tiny but mighty. There are 6 of us. And we have a lot of conversations about how healthcare is provided in our health centers and where we're doing well and where we really need to work on doing better. So this and I'm participant in a TGNC advisory committee that's coming up with recommendations for the organization going forward to try and make it so that our healthcare is as trans affirming as it can possibly be. And of course, we intended to have a conversation about the Trump rollbacks, and our meeting ended up being about something completely different, because so many things happened between last Friday and Tuesday when we had our meeting. So that's why I'm here. And I'm really, Ocean, thanks for inviting me to join the call. I really appreciate it.
We are definitely glad to have you. Also particularly glad Liz used to be my supervisor, so I learned a lot from her. So we had just been talking about the fact that there are technically best practices, but just because there are over 300 pages of very easy to read and very easy to implement resources does not mean that people read them. And so another question from YouTube, also from Joy, is, do we think that the average front desk staff member nationwide is properly trained? And then I'm going to follow that up with a question of my own with, I'm assuming that we all have similar answers, and the follow-up would be, what do we need to do in order to get to that place where front desk workers are able to provide trans-affirming care from the second someone walks in, immediately making that first step a little bit less uncomfortable, because there are people who maybe their doctors are aware of what it means to provide trans-affirming care, but if the first person you see misgenders you or doesn't understand how to appropriately behave, really, that is a big barrier to trans people even wanting to go to the doctor, let alone have procedures or go to specific types of doctor. Anyone, any thoughts?
I'll jump in. I know I said I would mainly just be listening and taking notes, but here I am. So it's an interesting question. I think, I used to work operations for hotels. So I've been, at that property level for a while, and I see a lot of guests come in and out, and I know how front desk staff interacts with them. I definitely think that it's something we need more work on as a community, as in the hospitality industry too. If you're meeting with all of these people, a consistent basis, like, you have to be properly trained to be able to talk to anybody that comes in, regardless of their gender. So I feel like something that we probably could implement, if we're talking about something actionable, I think that there should be something that starts in HR when you first sign on and you're getting trained on all the safety procedures. I think you would also need to be trained on how to address non-binary folks and ask people what their pronouns are and ask people what their name are. So, like, to me, that's something that I think is an actionable item for an HR staff. I don't know on the medical side if that would be the same kind of thing, but I think for maybe a corporate America front-facing kind of business like that, that's a pretty easy start.
Well, I would say, because I deal with this on a daily basis, while it would start in the healthcare setting in medicine, it would start in HR. However, this is one of those train-the-trainer areas. So in healthcare, training and continuing education sort of things don't get a lot of resources. The budgets aren't there for them. And when facilities have the budgets, training is the last place they put it. So while it's needed, and it's certainly a valuable place to put it, I think the problem is always going to be getting organizations to buy into the importance of affirming training, and it needs to be ongoing. And you can't just have somebody have like an hour worth of training in something or a day worth of training in something and think that they're going to be okay and be able to respond to certain situations or communicate well with individuals. It has to be something that's ongoing. And one of the problems I found is that not enough resources are dedicated to training, like a human resource officer or a staff on how to handle communications in certain settings.
I think the biggest thing is just not assuming and identifying someone as their gender when they walk in. Like I came out as trans, give or take 2 years ago, and then became hyper aware of strangers gendering me, and it happens every time I go out, and people just feel the need to make the assumption, regardless of your interaction with them, even if it's 5 seconds, to gender you as male or female. When there's so many ways you don't have to do that. You don't have to say, "How are you, ma'am," or "sir," or whatever. Like, just, people don't need to be gendered. And then just like there's so many alternatives to gendered language that people just don't really use, just like calling a group folks rather than ladies and gentlemen, or individually like ma'am or sir, and just pronouns too. You don't, like, especially when you're talking to someone directly, you don't have to use pronouns, but it does happen. So just, I think that's just such an easy thing that can be done that is very overlooked, but it's also a hard thing to catch because we're taught, to be respectful and polite, and that comes along with it. But it just happens so much, and it's very frustrating.
We talk about this a lot at Planned Parenthood. We have this diversity of health center locations. So, well, there's two things I'd like to contribute. One is that we are super clear that in order to change the culture at the health center level, it has the behavior of not automatically gendering people and not making assumptions about people really has to be modeled from the top down. And we, the social work team and other trans allies have been working at getting sort of the higher ups, the senior leadership at our institution to really be mindful about what they call the kind of care that we provide. It's Planned Parenthood is this old feminist organization, and it's been women's health care for such a long time. But you know what? It's not women's health care anymore. It's reproductive health care. It's health care for people. And it's just a sort of constant reminding everyone, like, what's the appropriate way to frame it. Then we have this broad geographical expanse, right? So we have a health center at LaSalle and Division that's pretty cosmopolitan and cityfied. We have a health center in Peoria that's actually pretty cosmopolitan. We have others that are much more rurally located. So those health center locations see trans identified patients, but on a much less frequent scale. So they might see 5 people a year, where near North might see 500 people a year. So I think the more the staff comes in contact with people who are trans identified, the more practice they get and the more comfortable they get engendering new habits, because that's what it's really all about. So part of what we're trying to wrap our heads around is, how do we support the people in the cornfield? That was bad, I shouldn't have said that, but the people who are downstate and sort of in a super rural setting and see very few trans identified people, how do we get them comfortable and normalize changing the way they use pronouns and the way they identify people when they don't have a lot of opportunities to do that? So that's just another something I thought I'd throw in.
Can I ask a question about that? Liz, I'm curious, you're saying, like, if there isn't a lot of opportunity for it, is it that it's difficult because of the lack of opportunity, versus like it's just difficult because it's something somebody doesn't feel comfortable doing, or I guess I'm curious about that.
Well, I think it's a combination of both of those things. And Charisse mentioned it. You can't just do a 1-hour training and expect everybody to integrate what they learn in a 1-hour training. And, people in healthcare are busy all the time, and there are numbers they're expected to perform to. So if there isn't space made for repeated engagement and interaction with learning new habits, and that costs money because you're losing service time, right? Or you're paying people to come in early so that they can have service time before they start service time. So there's this kind of dynamic tension that I say is the problem because we're capitalist. Even though we kind of don't want to be, but it is. We have to make the income to run the health centers, but we also want to run the health centers so that we're supporting the lives of the patients. So for people downstate, there are trans identified people who are coming in for services, but because they don't feel comfortable initially, because it's a big change from what their habit is, they don't get a lot of opportunity to engage over and over again, or to see their colleagues engaging over and over again. I think it's helpful for staff to see other people modeling what it is that we want them, how it is that we want them to be addressing people. And because one of our downstate clinics saw, I think, 3 trans patients over last year, which is just small. And I don't know if it's because there's not a lot of trans people. I don't know if it's not a safe, like, I don't know the reasons for it. The fact is the staff are not having opportunities. And also we do trainings, but it's a few hours once or twice a year, and there's not a lot of reinforcement.
Yeah, thanks. That's interesting.
I have a private question that's popped up. Thanks, Mom. Talking about it from a design thinking perspective. So how do we recreate that space from the waiting room all the way through to whatever procedure or checkup a person needs for someone, regardless of their gender, to just be and to not have to be gendered or be treated as if, all right, well, you look like this gender, so we're going to assume this. Like, how do we create space where anyone can walk into that space and be in a place that's affirming for everybody? Because I'm thinking of, I've had a couple of different people talk about their hesitation to go to OBGYN specifically, because an OBGYN, many of them say, well, this is a place for women, and a man walks in and everyone sort of looks around and they're like, well, what, like, is he here for his wife? And so in spaces like that, or in spaces where either gender is assumed or someone is just assuming a gender in general, how do we create or recreate or redesign that space so that it's not abnormal for someone who maybe doesn't present like the type of person who needs that care to receive that care without being considered outside of the norm? So how do we just re-norm everything to be consistent?
I think it starts with some messaging from the healthcare clinic. I think it comes to you have to have that on your website, that you're inclusive, that anyone can feel safe in this environment. Because I think that's the first way to just naturally show kind of the kind of environment that you offer is by putting that out there in the verbiage on your website, in your marketing material. And I think, we talked about the forms at the beginning. I think that's a really easy thing for doctors' offices to just implement that. Those feel like two really easy steps that already, like Hayden said, those are two little things that maybe go a lot further in the trans community than we realize. Being able to offer, what's your name, making sure that doctors are asking those questions if it's a first-time patient. Those are kind of the three things off the top of my head that feel like it's like the most simple thing you can do, It's not asking for a huge, you have to print all this new paperwork or you need to really update your website. It's really just a few things that take probably only a day to do. And so it would mean a lot to the members in this community. So I think that's a start.
I would add that, and actually it's not even an add, it's like an enhancement. Those simple things, like just having a sign in your office that indicates support, a welcoming, safe space. And it's interesting because I'm really tuned into deconstructing buzzwords. Like we'll say oh, this is a safe space. Well, what does that really mean? But even just having the symbol, and also just to articulate, one of the best things that you can say is just I hear you. Or saying I just want to let you know, or to be transparent for oneself is I have my limitations, I don't know all, but I'm here for you. And I think that's part of the process of making that connection. I'm wondering, and I'm actually struggling, because I've heard of this dialogue as well as the challenge as it deals with being culturally competent. So I don't know what would be the phrase, category in that same way in dealing with the trans population, because there is a certain competency, but cultural competency right now is limited to culture and race. So that's just something that just came to mind, because I've heard these, what you can do to create that space. And so that's what just struck me.
Yeah, so as Gertie and Pamela, you were both talking about the enhancement of just promoting cultural competence and cultural awareness. I wanted to talk about an anecdote I received. I had the option to have people write in or talk to me privately if they weren't comfortable being on camera. So I have a two-parter. Part number one is that this chat, I'm really glad that all of you were able to join. This chat is not necessarily a safe chat for people who want to be in this chat. And that's, I think, something that's really important being talked about, is there are people who are interested in this topic. There are people who would love to have a conversation about this topic, but having that conversation puts them at risk, whether they're living in an environment with a person with their family who is transphobic, whether they would be harassed at work, whether they would be murdered. Black trans women of color in specific, that is a population that at an extraordinarily high level, it's exponential from other populations. It experiences violence on a very regular basis, and that's something that people don't talk about. And so taking a look at it in terms of us in this conversation, we have the privilege to be able to be in this conversation and the ability to take a look around and say, all right, well, I'm not an expert. No one is an expert. That was one of the anecdotes that I received that I wanted to bring up, is that nobody is a trans expert. You have people who do the research on it, but they're not an expert into everyone's experience. Someone who wrote in is a non-binary therapist. They use they, them pronouns, and was talking about even within their organization, they said, I was gendered from the moment I walked in. Automatically assume my pronouns. They said, oh, we're getting an X gender therapist. We are getting this gender. People would say like, oh, I don't want to work with them because they are a binary gender. And so even within places that are like therapy, one of the biggest, like we have like a whole long list of things that we're supposed to do. And one of those things, like a good number of those things, is to not discriminate based on race, sexuality, sex, gender. Like it goes a really long list of non-discrimination, but not only is that happening with our clients, with our patients, with people in general, that's happening within healthcare institutions. That's happening where people aren't safe to be out with their peers who are therapists and whose job it is to provide affirming care. They're not, let alone they're not providing affirming care, they're not offering their colleagues affirmation that they see them as people. Thoughts, comments?
I mean, I think in some way, part of it is also like there has to be a willingness on people to come together and have a conversation, or to listen, or to be sensitive. And I think some of what happens at a time when there's so much that's going on in the world, there's a speed with which information is getting transmitted and so forth. I think people often get pulled, sadly, into places that they may or may not necessarily agree with, but there's like a sense of like having to respond to something, whether that's a text or a tweet or something on Facebook. There's like a sense that somehow that becomes like a place or a pool of like information or resource. And I think in some regards, what makes me sad about that is, we talked about this the other day, it's, there's something about being able to push pause and just to be thoughtful and be reflective and just to be genuinely kind, without judgment. It really actually doesn't take that much energy. And I think there's such an immediate knee-jerk reaction to respond. Or I think, Hayden, to what you were saying about like walking into a doctor's office and somebody like is immediately trying to decide what box to put you in, that it instead of just like letting somebody approach the desk to say, here, I'm here for an appointment, my name is so-and-so, this is what I'm here for. It's like we have to sort of quickly categorize or quickly characterize. And that's like a problem of, I think, of like, just, is there no impulse control? Is there no ability to just breathe and pause and just be like a responsible human being? That part, I guess, that's what this makes me think of. So.
May I respond?
Yeah.
You would think it would be so easy to be a responsible human being. It sounds so simple and eloquent. So I'm going to be transparent because I'm feeling like my heart is heavy in some ways. It pains me that, and also I'm so appreciative of those who are participating but can't be seen right now. And I understand that risk. And that hurts, but I understand as well. And I don't know why it's so hard to be kind. And to be kind is different from, and this is one of the things that I believe that I struggle with, agreement. You can have different points of views and ideologies, and you can exist and coexist. One should not have to be concerned about whether or not they're going to stay alive or not. With it being, and there's so many layers. There's so many layers, and I believe that I actually am cautiously hopeful and optimistic with where we are right now. There is this awakening of addressing things, but we all have to kind of own our own stuff, our biases, and practice that kindness on a new level. And it starts within, but also how we engage with others. I wish it was simple. I wish. I'm thinking about so many scenarios that go across the board. And I actually, more than that, because I also like to describe myself as an academic intellectual. I love knowing things. I know I can't know everything. I so want to know this. I so want to know this. And that's beyond my own identity. I just so want to know this. If what, and I feel like that we're getting closer, but that we can't miss the mark, or at least I'm feeling this urgency, not this time in life right now. We can't miss the mark. You know, this is a new window of opportunity. What can we do? So it seems very hard for us to have a different point of view, a different stance, and at the same time to be respectful and kind. I don't understand. So,
I mean, Pamela, I fully agree. I think it is, though, we have to listen with better ears. I just don't think it is. I mean, I'm optimistic about this, and maybe that's naive, but I think we just have a responsibility. I think I think we have a responsibility to, I know as a parent and as as an employer and as a clinician, I mean, I think that's like just integral to life. I think we just have to listen with better ears, and we have a responsibility to do that. And when we don't, I think it's deeply hurtful and wrong. And I think it comes down to, like, to your point, we can, there are shared components. Whether or not you agree with somebody about everything is a whole other piece. But, like, do you love your children, or do you love your partner, or do you love, your dog or your cat, or, I mean, you can agree about that. You don't have to agree about every single thing to just be, like, human and humane.
But okay, the advisor in me wants to say, no, you're not being naive. I feel like that also takes away. And I do this with my advisees, was like, don't take away your contribution and your strength of qualifying it. So that is a naivete to me. So that I just had to put that out there, and I'm listening and I hear you.
Yeah, Pamela, thank you for saying that. As we were talking, I have a quote from that same individual that I was talking about before. They said, if you don't have the humility to ask, then you aren't going to provide affirmative care. So it really just starts with the humility of knowing what you don't know. And we talked about this last week. We were talking about race in medicine. We were talking about, well, why are uncomfortable conversations uncomfortable? And it is in some ways not having the humility to ask in order to learn. And I think there are two parts to that. On the one hand, we need to have humility to ask people, I don't know what pronouns I don't know what pronouns you would use. What pronouns do you use so that I can use the right ones for you? On the other side of that, there is the kind of asking that is unnecessary. And that's where we need to have increased education, increased awareness. And this is something that I'm hoping this talk can at least start to disseminate. Everyone here is already pretty aware, but I'm hoping there are people who are watching this who are hearing something they maybe haven't heard before. But there is an expectation, and I think Hayden touched on this too, that people expect trans people or people of color or someone else of a minority group to explain it to them. What does this mean? What does that mean? How do we get X, Y, Z? And as a professional, that's not your patient's job. That's not your patient's job. That's not your client's job. Your job to have humility to your client is help me help you. Your job is not teach me about what you are or what you present as. Your job is help me help you, and I'm then going to do my own work. And where do we think that own work needs to come from? Is that from an individual? Is that from organizations? Is that from academia? Where are we going to create? Where are we going to find? Where are we going to do that work so that trans people don't have to do it for you?
I think going to that, just giving a real life ridiculous example of being asked invasive things. I once had a professor ask after I went on testosterone if I could now, if I grew a penis and can self-impregnate myself, and if it'd be possible for me to give birth. And mind you, she teaches reproductive justice. It was like the most uncomfortable thing. I was in her office hours, and she was like, "So can I just ask you this?" And that unfortunately, those kind of questions aren't rare. I get asked everything, and usually, I say, I'm really open. But then there's just questions that are just pure ignorance rather than beneficial. But in terms of resources, I think right now, social media has just been huge in providing resources. And there's just so many things that have been published recently, just not only with the whole Black Lives Matter movement right now, but just in regards to trans people, there's been so many things created by trans people that are out there online, just available. So just first, rather than going directly to a person and asking questions, there's resources out there. Find the resources and read the resources, educate yourself rather than having the person who's oppressed do the educating, I think is big. And that, that just applies to any marginalized community.
Yeah. Oh, sorry. We were talking about uncomfortable conversations, and the word I wrote down was unconscious bias. So it's so awful when I stumble across my own unconscious biases, and that creates a lot of internal turmoil for myself, because I really want to be kind and I really want to embrace other people. And then I say stupid shit, or I think it. And I think one of the things that's super important for all providers is to accept that they have it and to seek out ways to engage it and be with the discomfort of it and tolerate it within themselves. And I say that and I get goosebumps and feel a little ugh while I say it, because it's unpleasant. It's not pleasant, but it's super important. And another thought I had about physicians and medical providers not knowing, the whole point of medical school is to learn everything and know everything. So that is a really weird duality that I feel like good physicians figure out and others have a really rough time struggling with, because people come to them and say, tell me what to do. And when a doctor can't tell someone what to do, it's another zone of discomfort for those providers.
I think that is so dialed in correct. But I'm also sometimes so struck by where some of our young medical students are, or where they are as residents, and like what are emerging skills for them that you would maybe perceive would be in place or intact, or maybe just would be like kind of a precursor to going into a field like that and studying. And some of what I think we do in our work is also like, again, as a social worker, I think some of it is also being able to reflect back and just say, wow, okay, like let's just sit with that for a minute. And it is hard also when we step in dog shit ourselves. It's super hard and it's painful. And it's like the last thing you want to do. You don't want to, but then we are human beings. Everyone does. I say this all the time, like we make mistakes. People do make mistakes. But that's also why we create safe spaces, so that we can make a mistake and we can acknowledge it and like apologize and say, sorry.
Case in point, it's okay. Your coworker has something to say, and so therefore, let me build on what you just said. I think one issue that I think we're beginning to address more is we're human, we will make mistakes. And I know, and I'm using myself as an example, like I am my own worst critic. I hate making mistakes. I want, again, and also we have I will just say from my familiarization with this society, is that we kind of have a society where you're faulted for making mistakes. We're kind of punitive in our approach. I believe there are shifts, but that's part of it. And so providing, again, deconstructing the buzzword, the safe spaces, you can make mistakes. In fact, I'm hearing so much about fail well, don't be afraid of failure. And every time I say something like that, it doesn't matter the company, if it's my colleagues, if it's the powers that be, if it's the students, there is a visceral physical reaction to that. And it's like, but that's where we start to be creative and adapt. And I think the audacity of the opportunity we have right now is that we're dealing with a virus pandemic that has forced us to say, I don't know. I mean, globally, we don't know. And yet we are adapting. So we could actually learn from that behavior and apply it to all of the other challenges and issues. Something that Liz said, you reminded me, I actually had the opportunity to hear Cornel West speak live several decades ago. And he said something that has been etched that I think appropriately kind of combats that feeling of bias, where it's just like, he first, in his very forthright demeanor and speaking to this group, saying like, I know you have biases. I know this because I have biases. So let's sit down at the table and talk about our biases. And interestingly enough, and this goes back to the last thing I'm saying, then I have to depart, which let me just say, such gratitude, appreciation, and thanks to everyone that I see and that I don't see. So thank you. And to use a wonderful vernacular of the youth, I see you. And thank you for your presence. But in the admissions processes to select medical students, and I would say in all students, but it's called holistic process. And part of it, the phrase is to check your bias, because we have our biases, so check your bias. So it's that self-accountability of things. So to do this and not be one, reactionary, but two, not do as incidental. It has to be incorporated. Like everything that's happening right now can't be a phase. It has to be a longitudinal commitment. And that includes all the things of like checking one's bias. We all have biases. We all make mistakes. We will stumble and fall. It's not so much a win. And actually, I just cringe by saying that when we make mistakes. So, but how we react and respond and support when we don't live in our mistakes, that we can grow from it. So I feel very enlightened by this experience. So I apologize that I have to leave, but again, I'm so thankful. And hopefully to be continued.
Yes, thank you so much for joining us, Pamela. I really appreciated everything that you had to say. And yeah, hopefully we will see you again on another Fireside soon. So for the rest of us, tragically, we are wrapping up. And so I just wanted to go and make sure that anyone who had a last comment or a last word is able to get it out, put it out there, and allow that thought to be put out and to be heard.
I'm going to just say thank you, Ocean, because I didn't mean to interrupt you, Hayden. Sorry, we were about to. I just want to say thank you. And I love the articles that you posted, and I had looked through them, some of them beforehand, and some of them as you guys were talking, I was pulling a few of these up. It was really done beautifully. So thank you. I appreciate the work that went into this, and I hope this is the beginning of many, many, many more conversations. So thank you.
I just had one thing to add, and Ocean, I appreciate that you didn't do this. But one thing that I see that happens more than not, I meant to bring this up earlier with forms, is asking people their preferred pronouns rather than their pronouns on forms. It's never just your pronouns, or when people ask you to enter like on an online form, a medical form, whatever, it's always your preferred pronouns, but it's not a preference. It's just your pronouns. Like we would never ask a cisgender woman, hey, what are your preferred pronouns as a cisgender, cis passing woman, but it's like in asking a preference, it's like, oh, this is just what you prefer, but this isn't actually not required for who you are. So just really pushing, it's not a preference, it's mandatory, I think is one small easy thing that people can do in any field, just moving forward, just getting rid of the word preferred. And yeah, thank you. And I appreciate you not doing that, because more often than not, when people in the beginning go around, they're like, okay, everyone say their preferred pronouns, but you didn't do that. So just kudos and thank you.
I would just add to that, Hayden, that when we know better, we do better. So when I look at workflows and healthcare and that type of thing, I think we are going to a good place. But I think right now we're still trying to get comfortable with all the different languages. And like I said, one thing I always say that we've gotten right amongst each other in healthcare is that we've all decided to be bad communicators together. So I think those are some of the growing pains that go along with learning to accept people for who they are. And I think the healthcare system is just, frankly, one of those places where I always compared to British fashion, we're always 5 years behind the curve. So we'll get there. But I think you're absolutely right, because even myself, when I see a doctor, whatever, they always say, what's your preferred pronoun or your preferred, I can't remember some of the language they use, but I'm always like, what do you mean preferred? So yeah, you're absolutely right. But I think it's part of the growing pains we're going through now with workflow systems in healthcare.
Awesome. Well, I'm going to just jump in here and thank you guys again. As I kind of mentioned at the beginning, Fireside at 5 was a platform that we created to come together for collaborative, intentional discussion with diverse minds. And I think that's what we've done today. I feel like such an honor to be on this call with you. And Ocean, I echo what Loren said. Thank you for putting this together with such a thoughtful agenda and really, making this a conversation that's accessible for a lot of us. And for the people that didn't feel safe joining today, I hope that they were able to, take something away from this as well. As everything continues to go in 2020, we've really started to rethink about what we can use this platform in the most positive and impactful way. And we feel that these kind of conversations are at the crux of all of that. That's what this platform can do. It can really inspire people to get off of this call and go, call their boss and see what kinds of things they can do in their office place, or post on social media about a trans issue that's going on right now. These are all things that we can action off of. And so creating a space like this where we can come together to discuss those actionable items is really, really important. And I appreciate everyone taking the time out of their day to share with all of us. So, please look out for more firesides on these kinds of topics. We've got one next Friday. Ocean, you're going to be facilitating that one as well, I believe, right?
So next Friday is on the intersection of race, gender, and sexuality in medicine. So we're talking about both visible and invisible minorities and how the intersection of that creates a very specific nexus for people who do sit at that intersection. But to wrap up today, I just wanted to say thank you so much, everyone, for participating. If you're watching, thank you. If you're watching it later, thank you. That I will say is in the agenda that all the participants have. At the bottom, there are links to resources, and all three of the links to resources are extensive guidelines for community organizing, for training of frontline staff and of medical practitioners, there we go, that's the word, as well. And so one thing that you can do, and I'm hoping that we can post these and disseminate them, is start by sharing that. Start by sharing the things that these are linked from the American Medical Association. These aren't just pulled from different places on the internet. This is the American Medical Association saying these are the competencies, these are the guidelines, this is what we should be looking at. And so if your organization isn't following those guidelines, or if you don't know if people have seen those guidelines, that's a really great place to start. It's a really good resource. I was reading through it and I was like, that, I 100%, that makes total sense, but I never would have thought to specifically include that in a training or in an understanding. So that is, on my end, something that I plan to share, and I'm hoping that all of you are willing to share as well. They are going up on the Fireside blog, yay. All right, so again, thank you all so much. I hope to see you on future Firesides. Had a really great time chatting. Oh, and the LAS blog, 2 blogs. And I will hopefully see some of you soon. If not, it was really great doing this with all of you. Thank you for participating and being open.
Thanks, everyone. Have a great Friday and a great weekend.